I'm Ken from the Department of Respiratory Medicine in SGH, and today I'll be sharing with you more on smoking cessation. Okay, so yeah, I just want to share, I think among us today, among the participants, there's probably a mix of both smokers and non-smokers. So this presentation itself also hopes to offer a perspective that is not often seen among our non-smokers. So I think for the longest time, we feel that smoking, it's a lifestyle choice, it's a personal choice, and we don't really see as a problem if we are not smokers. But that is not the case. So before I go deeper into the effects of smoking and smoking cessation techniques, I just hope to offer some data with regards to how smokers might think and the reasons they take up smoking. So this is a results taken from a survey that's conducted by the Singapore Cancer Society, looking at the various factors that contribute to smoking. And you can see that actually a lot of these factors are due to the environment that the smokers are exposed to. 58% of the youth, the young smokers, report having parents who smoke, as compared to only 27% among non-smokers. 90% of smokers will have at least one close friend who smokes. And of course, the media influence is also significant as a factor for youths who are often easily influenced. Curiosity, so teens tend to experiment with smoking, thinking that it is cool. And sometimes the health effects of smoking are also downplayed by many smokers. And a lot of our youth actually underestimate the addictive nature, believing that they can choose to quit smoking at any time. So, and also when we ask our people we know who are smoking to quit smoking, we often forget that actually there are additional reasons why some smokers continue to their smoking habit. And these are some of the so-called benefits that smokers feel. They actually use smoking as a relief for their stress, help them cope with their anxiety. Some of them feel happier or more relaxed with smoking. And in other cases, they might just smoke in social situations. Well, I think, well, based on what I've shown you, essentially what this means is that, if the smokers are in the right environment, there is a high chance that they have a higher chance, there's a high chance they might be able to quit smoking successfully. And a lot of times, if you think, if we are born in an environment where we are surrounded by smokers within our family, our relatives, or even our friends, then there's a high likelihood that smoking forms a major part of our lives. And so there are this is one of the factors that we should consider when we look at smokers and see how we are able to help them. I will come to that in a bit. Okay, so this is something that we are all very familiar with. Many of us are aware that smoking has detrimental effects on our health. These are just some of the facts and figures that I hope to highlight. Number one, smoking-related chronic diseases, they develop only after a few decades of smoking. The lung cancer risk is 25 times higher among the smokers compared to non-smokers. And even light smokers are at increased risk of lung cancer, and you don't really need to smoke many cigarettes to increase the risk of lung cancer. When it comes to heart disease, coronary heart disease and stroke risk are 2 to 4 times higher among the smokers than the non-smokers. And it's important to remember that, if you are able to quit smoking before age 40 years old, you're able to reduce the risk of death from smoking-related diseases by 90%. So this is a study taken from one of our major medical journals. There are a few things that you can see from the results shown in these graphs. The first thing is, basically on the y-axis, it looks at the survival of patients from age 30 years old. And the x-axis shows whether they will survive to age 80 years old. And you can see, basically from the graph in the top left-hand corner, that actually about half of the proportion of smokers, actually 50% do not reach age 80 as compared to those who have never smoked before. And the other important thing that you can take note from this study is that you can stop smoking at any age, and the earlier you stop, the more number of years you gain. you know, even if you have you continue smoking to age 55 to 64 years old, if you were to stop, then you will still gain a few more years of life compared to if you had continued smoking. So it's never too late to stop smoking. All right. And it's not just the heart and the lungs that we're worried about. If you look at the other health consequences, it can have effect on your diabetes, as mentioned earlier. It can cause many other kinds of cancer, not just lung cancer. It can affect, it can cause cancer in the throat. It can affect the pancreas and many other organs as well. So I think, well, among the smokers, there will be many people at different stages of, where, that some of them may be thinking, oh, I want to stop smoking, but, maybe sometime over the next 6 months. Some of them are prepared to stop smoking within the next 1 month. And there are also a proportion of people who have never even considered that. We found that 3 in 5 of current smokers were actually concerned about the ill effects of smoking. And actually, about half of these smokers have plans to quit smoking, even though 1 in 5 of them actually plan to quit smoking within the next 12 months or less. Even among the ones who do not intend to quit smoking, they found that actually close to 30% of them hope to at least cut down the number of cigarettes who smoke. So essentially, this pie chart here indicates to us that actually, even among the smokers, there are a lot of people who want some form of help, either to quit smoking completely or to at least cut down the number of cigarettes. And so the purpose of my talk is to at least inform them some of the tips and some of the areas where they can obtain help from to help them quit this smoking habit. And the other important thing to take note is that many smokers actually have to try quitting more than once, on average about 4 times before they are able to quit smoking successfully. So we mentioned briefly about the pre-contemplation stage. Contemplation stage, meaning this refers to the smokers who plan to quit smoking sometime over the next 6 months. Preparation stage refers to smokers who are ready to smoke ready to stop smoking within the next 30 days. Action refers to the stage whereby actually these smokers have already quit smoking sometime within the past 6 months. And then the maintenance stage refers to those who have successfully quit for at least half a year, and hopefully they are able to maintain their non-smoker status for the many years to come. So these are some of the health benefits that you can expect to experience once you have stopped smoking as early as 8 hours. So things like your carbon monoxide level actually drops. Within a short period of 3 days, your breathing gets easier, particularly if you have underlying lung problems. The smoking is going to worsen it. Your blood circulation improves as well. Okay, for the young ones, the fertility is an issue that you might be worried about. If you smoke, that definitely has an impact on fertility. Some of us, experience coughing, and smoking would definitely worsen that. When it comes to heart attack, within a year, the smoking-related heart attack is actually reduced by 50%. And then when it comes to cancer, within 5 years, cancers of the mouth, the throat, esophagus are halved, and the risk of lung cancer within 10 years is reduced by 50%. Yeah, so if you're able to quit smoking 15 years, then the risk of heart attack and stroke is almost equivalent to someone who's never smoked before. So what should you do? Okay, number one, if you are smoking and you really have tried to quit smoking, I think the highest chance to succeed with quitting is to actually seek professional help, because studies have shown that 3 to 5% of smokers who try to quit smoking on their own, based on their own willpower, will be successful at the 12-month period. So with professional help, the chance of actually quitting smoking actually increases multiple folds, more than 5 to 6 times. The withdrawal symptoms that smokers will experience will typically peak within the first 2 days, and if you're able to hold off the cigarette, this withdrawal symptoms actually get better and after 1 to 2 weeks. Relapse usually occurs within the first 8 days of quitting, and even for those who successfully quit within the first 6 months or so, there's a 10% chance of relapse at 1 year, and 2 to 4% relapse after 2 years. So it is important to remember that this idea of relapse it's really common among smokers, and the key message here is to not give up. And if you pick up smoking again, you have succeeded before, you should try to quit again. So these are some of the quit methods that are often used. Okay, one is the gradual reduction of the number of cigarettes that smoke. Some people choose to go to cold turkey. Okay, but often there will be a lot more withdrawal symptoms, and sometimes the experience will be very challenging for the smoker to overcome. And therefore, the recommended approach to improve the success rate of quitting smoking is a combined therapy using nicotine replacement along with professional counseling provided by our smoking cessation counselors. Okay, so the idea of smoking addiction, number one, it is a medical problem. Okay, I mentioned at the beginning of my presentation that it is not just a lifestyle choice, but these people actually have a problem with addiction. And the addiction is not just the physiological addiction. There's also the psychological component as well as the behavioral dependence. And I say this because you will find that not all the smokers experience the withdrawal symptoms even if they stop smoking, but they might still carry on the habit simply because maybe they depend on it to overcome the stress and their issues with anxiety. That's the psychological dependence that they have. Or in some cases, it might just be a case of a habit. So, sometimes you switch on the TV, and then the next thing, take up a cup of coffee, and on your left hand, you're having this cigarette. So that becomes a habit. So even if the body doesn't experience the withdrawal symptoms, even if they're not stressed, it becomes a habit. And that is something that needs to be addressed with professional counseling. Okay, so in this survey by the Singapore Cancer Society, it highlights once again that the environment plays a huge role in terms of helping patients quit smoking. So it is more likely that the smoker will succeed in quitting if there's a conducive environment, if he receives the support of his parents or other family members, as well as peer support. So some of the very simple tips to help quit smoking. Okay, the 4Ds is something that you can easily remember. For those of you who smoke and you have already tried on your own to try to quit smoking, even you have sought some professional help, these are some of the things that you can keep in mind. Okay, each time you want to take up a cigarette, try to delay. Okay, you wait for about 5 minutes. The urge to pick up a cigarette may just go away. Do some deep breathing for about 5 minutes. Breathe slowly and deeply. You may want to distract yourself by talking to a friend. Okay, preferably a non-smoker. Okay, get up, walk around, and then drinking some water. Okay, sip the water slowly and then hold it in your mouth, and that itself can help to maybe hold off the cigarette that you wanted to pick up initially. Okay, I'm just going to talk a little bit about the kind of pharmacotherapy that we use to help patients with smoking cessation. The most common one that is recommended is actually the nicotine replacement therapy. Okay, it comes in various formulations, including patches, gum, lozenges. And the good thing is that it is also available over the counter to patients above 18 years old. Okay. There are other medications that can be tried if your nicotine replacement has been tried and you find that it is not helping you as much as you hope, but that will require the doctor to assess you and then decide what prescription is necessary to help you with this smoking cessation. Okay, so when it comes to NRT, okay, it is not as simple as just taking a nicotine and hoping that the smoking, habit just stops, because there are a few important techniques. Number one, we believe that combination nicotine replacement is more effective than nicotine monotherapy. So I mentioned about different formulations. So most of the time when your counselors speak to you and advise you on how much nicotine is needed, most of the time the smokers are advised to take a combination of both patches along with either gums or lozenges, because it is found that a combination of these would actually improve the success rate as compared to just one of these on its own. The dosing is important. So, the appropriate dosing is necessary because naturally the heavier smokers would require a higher dose of nicotine replacement to help them to overcome the cravings. Okay. Duration, most of the time, the replacement therapy is required for a minimum of 3 months, and sometimes it might be extended even to 6 months to try to maintain the smokers off the cigarette. And of course, the technique is important. When you get the nicotine replacement, for instance, with the use of the gum, there's a technique which the pharmacist will teach you on how to use the gum, place it, instead of swallowing it, it should be correctly placed for it to work appropriately. Okay, my final few slides, I'm just going to talk a little bit about electronic cigarettes because this is something which has been buzzing around and sometimes patients are keen to find out a little bit more. I think electronic cigarettes has been marketed as a strategy to reduce smoking it's a harm reduction strategy. But I just hope to present to you some of the data to highlight some of the potential harms that may not be that smokers may not be aware about. Okay, first of all, I think the statistics show that there's a drastic increase in the number of vapors, across the region in many countries over the years. Okay, and that is a problem within Singapore itself. You can see that the number of vape cases has also significantly increased, from 2004 to about 3 times within the span of 2 years. So, harm reduction strategy, is it really less harmful? I think the potential harms can be divided into the immediate harms experienced by the patients versus the long-term harms, which are still under research and uncertain at this point in time. There are multiple reports of immediate harms, including device malfunction, because the e-cigarettes actually contain, for instance, the battery, and there have been explosions that's been reported before. There's e-cigarette and vaping associated lung injury, and some of these injuries are so severe that the smokers actually are admitted to the intensive care unit. And you can imagine the stay in the hospital is prolonged, the recovery is prolonged as well. And a lot of these patients who are actually quite young will subsequently suffer the impact later on in their lives. In terms of long-term harms, okay, vaping itself is promoted as a means to try to quit smoking. But the problem with that is that vaping itself actually contains the nicotine, which means that patients who try to use this as a strategy actually are sustaining their nicotine addiction. And it is this nicotine addiction that we're trying to help them overcome so that they do not pick up smoking. And so because the e-cigarettes itself contains nicotine, some of them even higher amounts compared to the traditional cigarettes, it does not help patients to overcome the problem with the addiction to nicotine. And there's a whole list of respiratory, cardiac, and cancer risks, which are probably associated with the contents that's in the e-cigarettes. Well, the potential benefits, of course, would be that the patients might be able to decrease the number of cigarettes they smoke. But when you speak to a lot of these these vapors, you'll find that a significant number of them continue to smoke along with their vaping. So instead of just using traditional cigarettes, they are vaping and smoking at the same time. So actually, they are suffering the consequences of both habits. Okay, so these are just some of the reports that I've mentioned, some of the injury from the devices that are used. Okay, and you can see this is statistics indicating the number of emergency visits in the US hospitals due to lung injury that's associated with e-cigarettes. So in summary, there's not enough scientific evidence to support electronic cigarettes as an aid to smoking cessation. There is a high risk of a sustained nicotine addiction and actually increased harms associated with the use of electronic cigarettes as compared to the licensed smoking cessation strategies that I've mentioned earlier. And the long-term effects of e-cigarettes are not established as well. Okay, so I think to end off, I'll just say that it's not too late and it's never too early to quit smoking. We should do it the right way right now. And these are just some of the services available in Singapore where you can seek professional help to quit smoking. Thank you.